Welcome back to East Texas Live on KETK. Well, joining us in the living room now is Sheldon Freeberg from CHRISTUS Trinity Mother Francis.
And he's here to tell us about their new heart technology. How are you?
I'm doing well. How are you guys?
Great.
Good.
So tell us a little bit about this heart valve.
Okay, so this is a new technology that's been released since 2011 that we're now offering to East Texas.
Okay.
Where before, people with aortic stenosis, which is the most common valve to degenerate as you age, they weren't able to undergo surgery because they were too sick for various reasons.
Right.
And now with this new technology, we can do it with a less invasive approach. We're able to go through a small incision in the leg and replace the valve with a brand new valve here. This is kind of depicted in this model.
Okay.
Yeah.
So that's the valve right there.
Yeah, what you see here is,
Okay.
that's right, that's the valve, and what we do is we come in through the leg over a small wire,
wow.
and then we're able to implant this new valve where the old valve was sitting.
Okay.
And
Yeah.
that whole procedure takes about an hour, hour and a half, and people end up with a brand new valve where traditional surgery can last 3 to 4 hours and have to cut the chest.
Right.
This is a lot less invasive approach.
Well, besides being less invasive, why is this beneficial to patients?
So in Europe, anyone pretty much over the age of 70 that needs a valve, it's done through a catheter approach. So length of stay is shorter. People actually do better in their recovery process.
Yeah.
And for some patients, particularly in the U.S. that are too high risk for surgery, this is a great option for them and a good durable result.
Yeah.
And so we know that heart surgeries are always risky when you go into them. So what is different about this surgery?
So the difference in this approach is that the patient is seen by a multidisciplinary heart valve team. So that includes surgeons, cardiologists, all in our heart valve center, and here in Tyler, Texas. So, and so a lot more attention is put into these patients on who's a great candidate for it. And so decreasing rates of stroke, very important, and we're getting great results that are very comparable to a surgical valve. In fact, our first patient, who was 88 years old, she was on her iPad that night after we put it in the valve. Yes.
Look at her go.
Yeah.
Wow.
So how often are you guys having to do these kinds of surgeries then?
So we're offering approximately once a month, sometimes 2 times a month, depending. Because the procedural time is a lot less, we can do 2 to 3 procedures a day. And we started our program here in Tyler in January, and we're cruising along.
Yeah.
And so why would you recommend people to do this surgery versus others?
I think it's important that everyone knows what their options are, and I think that it's important to have a well-rounded view on how to treat a severe valve problem.
Right.
This is a critical problem and is associated with high death when it's left untreated. So it's important to know if a less invasive approach gets you the same outcome with a shorter length of stay and better quality of life, then by all means, why not? You know.
Right.
So, and the nice thing is we're doing this here in Tyler. People don't have to drive to Dallas or a bigger city, and we're doing this all here in an expedited fashion.
That's great.
Sounds good. Thank you so much,
Thank you
Sheldon.
so
Oh, no
much.
problem.
Appreciate
Thank
it.
you. Yeah.